Good morning. So nice to see you this midday of the week. Hope your day is off to a great start and that your holiday shopping is going full throttle ahead and you feel confident as you head into these last several days. We're going to take a little bit of a pause from our holiday conversations as we kick off the show this morning and instead talk about your health. Because at Center for Sports Medicine, their doctors work very hard to find the right solution for their patients, whether that means surgery or non-surgical interventions. And that certainly is true of our next guest. Dr. Michael Herman specializes in non-surgical, listen closely, spine interventions at Center for Sports Medicine. And he joins us this morning. Good to see you.
Thank you.
I can't tell you how many times I've had conversations, and you have probably heard yourself, people say, I'll do anything to avoid back surgery. Sometimes it's what a patient needs, but trying to ward that off is very beneficial.
Yes, ma'am.
So what does it look like for you, these non-surgical interventions? Because as I understand it, at Center for Sports Medicine, you do some things differently than other practices might do.
Yeah. Well, I think, you have those patients who are, good with conservative care. You don't have to do much and things kind of get better on their own. And then you have folks who need surgery, but there's a whole, breadth of patients in between, and those are the people I help.
Interesting to me was when you and I were talking earlier, you mentioned that sometimes the patients who you see have had a back surgery and they didn't quite get the outcome they were looking for. You can still help that way as well.
Yeah, and that's kind of what I tell folks is I don't think this needs to be the rest of your life. And just because you've had an intervention that maybe didn't go the way you planned, it doesn't mean that you can't be helped. So
back pain is pretty debilitating, even if it's just that you've pulled a muscle for a few days and you're struggling through it. But for those who live with chronic back pain, how early should they come in to talk to you?
Well, we usually try to see patients as soon as possible, try to prevent any undue suffering.
So if you pull your back, let's say it's Christmas season, you're hauling some things around the house, you're getting that tree out of the house, and you strain at your back and you feel it. Does the early bird get the worm? I mean, is it a good idea to come on in and see you?
Sure. If it's impairing your function and you're unhappy with how you're doing, we'd like to see you.
What do your non-surgical interventions look like? Can you give me some examples of things that you do?
Sure. I mean, that could be as simple as a referral to physical therapy and help folks get better on their own. There's various injections that we do and procedures to help folks, like, just a simple epidural. And that could even be something, more complicated, like spinal cord stimulation, which, would be more on the farther end of things.
Okay, on the epidural side, is that reserved for a specific part of your back? Because your spine goes all the way through, so is this also true for shoulder and neck pain as well?
Sure, definitely neck pain. We do epidurals anywhere from, the neck to the low back.
So if you have, because I think I know somebody who's had something like this done. And it was a nerve pain that he was dealing with in his neck. But they were, the kind of the tell-all was going to be that they were going to try the epidural, and if it worked, that was very telling. And if it didn't work, that was also very telling. Am I on the right track?
Yeah, sometimes it's hard to tell if it's a neck issue or a shoulder problem, just like if it's a low back or a hip problem. And we try to minimize injections for diagnostic purposes, but sometimes they're needed. And if folks do really well after an epidural, that kind of gives us a clue as to which their problem is and puts us on the right track.
And then if it does work for you, which means that you would not need the surgical intervention, is that right?
Often,
Okay.
yeah. I mean, a lot of folks don't need surgery, but if, I always say if what we're doing isn't working and we need to send you to somebody who can help you.
Right.
And sometimes that does mean surgery.
So okay, on the epidural side of it, if that's beneficial for you, is there a limit on how many you can have done in the course of a year, or how long do they typically last?
Well, that's a good question. I get asked that every day. I always tell folks we'd usually do one, see how it works, and kind of see how long it lasts. We try not to do more than, maybe 3 or 4 in a year.
Okay.
But we try to, minimize those folks who are getting those serial epidurals. We
Right.
do one, see where you land, and if you're not getting the result you want, then we try to do something differently.
And often that result is fairly immediate. Okay.
It can be immediate. We always say give it a week to work.
Okay. So then on the spinal cord stimulation, what is that?
That's something most people have never heard about. That's usually reserved for folks who have either had surgery and it didn't work, or they're not a candidate for surgery. And that always involves a trial where we put two small, we call them leads, in the back and see how that helps folks. And if it makes a big difference, we can do something called a spinal cord stimulator implant, which is kind of like a pacemaker for pain.
Really? So what is that doing? Sending like a signal to like nerve block or something?
Kind of, yeah. It minimizes, I always say it minimizes unnecessary information that goes to your brain about pain.
So on the physical therapy part of it,
Yes, ma'am.
if you've ever had a back injury, and you often physical therapy will be what you're referred to, is it important in your opinion to keep up with that even over the course of years, not just for the few months and let it go?
That's a good question. Yeah, you know, physical therapists, it's not just about stretching and training folks, but I always view it as helping people learn about ways that they can not injure their back again. So they may be doing something they don't even know about that's predisposing them to an injury.
If you've had a car accident or something like that, and you have any kind of neck or back pain, really important to have it looked at quickly?
That's what we usually recommend.
Okay.
Yeah, early physical therapy I always think is a good idea.
Okay, and remind us, when you're heaving all that stuff at your house this season, when you're doing it at your house, how do you lift? What's the right way?
With the legs, not the back.
With the legs, not the back. Okay.
That's right.
Great to talk to you.
Thank you.
You'll find Dr. Herman at Center for Sports Medicine. They have so many locations. Am I right at 8 or 9? 8, 9, you go 11? The number keeps going up. Sportmed.com is the website. 624-2696. With all those locations, there will be an office close to you to get you feeling great. Thank you, Dr. Herman.
Thank you for having me.